Hello, my topic today is investigating the feasibility of MR-guided Fox ultrasound for minimum invasive heating of mesial temporal lobe structures. So the goal to treat temporal lobe epilepsy using Fox ultrasound is to ablate the mesial temporal lobe structures, which is however considered to be outside treatment envelope of the current clinical device due to the low treatment efficiency. Because the target is quite off-center, so the peak temperature won't be the same as the target, which is close to the center of the brain. So here we will try to use the 220 kHz system because by using lower frequency, less energy will be absorbed by the skull. And we'll also apply longer sonication duration just to deliver enough energy to achieve ablative temperature. So the second issue could be potential skull heating. So we will just try to use less power with longer duration. And if the skull heating is still significant, we will try to turn off some transducer elements which directly cause the skull heating. And the third issue could be large volume that need to be treated. So the strategy is just to apply multiple sonication to cover the entire volume. So our work here is to perform simulations and experiments to verify those approach. So here are our simulation method. The first step is to calculate the acoustic field by solving the full wave acoustic propagation equation. Using that as an input to the Bell heat transfer equation, we'll be able to have the temperature distribution in the brain and the skull. And the skull properties used in this model are acquired from CT images. The experiment was done on ex vivo skulls filled with brain-mimicking phantom. And the first step is based on the simulation, we'll locate the skull heating, then attach a small couple there, then we will fill the entire skull with phantom. And the experiments were done on the clinical system with exactly the same setup as the clinical treatment. We first performed a simulation to compare the 670 and 220 kHz system. We found that to achieve similar ablative temperature, it requires much more power on the 220 kHz, which exceed the power limits and may also cause cavitation. And if we look at the focal spot, it is more scattered. So here we think the 670 is a better approach to ablate mesial temporal lobe. Here we compared the experimental and the simulation results on one skull, and we found they generally agree with each other. In the experiments, we found that the highest temperature rise on the target is 51 degrees based on the MR thermometry. And in this case, the skull temperature rise is 10 degrees according to the thermocouple measurements. And as we proposed, turn off some transducer elements could be further decrease the skull heating. In this case, if we turn off the transducer elements, which directly cause the skull heating by 100% power or 50% power, the skull peak temperature can be decreased by up to 3 degrees without disturbing the focal shape. As we mentioned, multiple sonication will be needed to cover a large volume. Here we perform simulation of sonicating 3 spots continuously. Here is the temperature results. We also calculated the thermal dose in the unit of accumulated equivalent minutes 43, which is related with the final thermal lesion size. So in this case, the 40 cm 43 is about 1.4 cc, which is a reasonable lesion size. We continue the simulation to up to 5 spots with cooling duration between each sonication because that's what the system needs and also to avoid the accumulated skull heating. And we found we still be able to achieve 1 to 3 cc lesion with 5 spots sonicated. However, these results need to be verified on a cadaver head model because lesion cannot be created on a phantom. Conclusions. So the 670 system provides a better focusing on MTL And the 51 degree was achieved on MTL, while the skull heating is 10 degree, which can be further decreased by 3 degree by implementing the elements blocking. With 5 targets being sonicated, the cumulative thermal dose can be 1.5 to 2 cc. And more importantly, I think this experiment and simulation platform can be an important tool to plan and guide future clinical trials. And I would like to thank the grant support and my colleagues.